As the world steps into the year 2025, the landscape of global health reflects a mixture of remarkable progress and complex new challenges. Over the past decades, the dedication of scientists, healthcare workers, policymakers, and communities has brought about vast improvements in combating diseases, increasing life expectancy, and shaping healthier societies. Yet, the interplay of social, environmental, and technological forces continues to create hurdles that demand innovative solutions and renewed global cooperation. One of the standout achievements of recent years has been the worldwide response to infectious diseases. The legacy of the COVID-19 pandemic, while devastating, propelled a revolution in vaccine technology. mRNA vaccines, now refined and widely distributed, serve not only to combat SARS-CoV-2, but also open doors to prevent other infectious diseases, including certain strains of influenza, HIV, and even some cancers. Accessibility to these vaccines has increased, with global partnerships ensuring doses reach low-income and remote regions more efficiently than ever before. Mobile clinics, drone deliveries, and digital health records have helped bridge persistent geographic and social gaps. Immunization campaigns have seen measurable success in reducing the burden of traditional infectious diseases. Rates of measles, polio, and tuberculosis have fallen in many parts of the world, thanks to combined efforts from governments, NGOs, and local health workers. The momentous declaration of wild polio virus eradication in 2 out of 3 major global regions is a testament to what sustained commitment and international solidarity can achieve. Yet, new variants of familiar pathogens constantly pose a threat. Mutating viruses and antibiotic-resistant bacteria remind us that the fight is ongoing, necessitating continued investment in surveillance, research, and global coordination. The threat of Disease X, a hypothetical future pathogen with pandemic potential, remains at the forefront of international preparedness, prompting investments in early warning systems and worldwide data sharing. Meanwhile, the focus on non-communicable diseases, NCDs, has intensified. In 2025, heart disease, stroke, diabetes, and cancer together account for the majority of deaths globally, affecting both developed and developing countries. Sedentary lifestyles, urbanization, the prevalence of processed foods, and air pollution have amplified the NCD burden, even as remarkable medical advances offer new treatments and prevention strategies. Wearable devices and digital health trackers are now commonplace, empowering individuals to monitor their health and manage chronic conditions more actively, yet disparities in access remain evident. Mental health, once a neglected aspect of public well-being, is now finally occupying center stage in global health discourse. The pandemic's psychological toll illuminated the urgent need for robust mental health services. New initiatives seek to destigmatize mental illness, integrate mental health into primary care, and leverage telemedicine to extend services to previously underserved populations. The inclusion of mental health as a universal health coverage priority represents a shift toward treating the mind and body as inextricably linked components of overall health. Environmental forces, too, are shaping the new reality of global health. Climate change has emerged as a defining challenge, looming over all health ambitions. Rising temperatures, extreme weather events, and shifting ecological patterns have real consequences. Outbreaks of vector-borne diseases like malaria and dengue are on the rise in regions previously considered safe. Food security is at risk due to unpredictable harvests and water shortages. Urban pollution and wildfires exacerbate respiratory diseases, particularly affecting children, the elderly, and the vulnerable. As a result, public health is now closely intertwined with environmental stewardship. Collaborative international frameworks are addressing the health impacts of climate change, with adaptation and mitigation strategies taking precedence. Investments in early warning systems, community resilience programs, and green infrastructure aim to buffer populations against health threats exacerbated by a warming planet. Technology continues to be a double-edged sword. On the one hand, The integration of artificial intelligence and machine learning into diagnostics, treatment planning, and drug discovery is streamlining processes and improving outcomes. Smart algorithms identify health trends early and personalize care, while telemedicine brings medical consultations to remote corners of the globe. On the other hand, the digital divide, driven by inequalities in access to devices and reliable internet, threatens to widen health disparities. Data privacy also remains a key concern, as health systems wrestle with how to protect sensitive personal information in an increasingly connected world. The mobility of today's population brings another dimension to global health. Migration, driven by conflict, economic hardship, or environmental shifts, can place enormous strain on health systems. Refugee populations often face barriers to accessing care, carry unique health burdens, and require culturally sensitive solutions. Successfully integrating migrants into national health strategies will be crucial to ensure that no one is left behind. Women's health is another domain seeing both gains and ongoing challenges. Maternal mortality rates have declined in many regions, but progress is uneven, particularly where gender inequality persists. Access to reproductive health services remains sharply divided between and within countries. In some places, progress has been rolled back due to political or economic instability. Empowering women with education, economic opportunities, and control over healthcare decisions is fundamental to improving not only individual well-being, but also entire communities. Global health security is an ever-present concern. As the world grows more interconnected, localized outbreaks have the potential to become global crises. Investments in healthcare infrastructure, supply chains, and trained personnel form the backbone of resilient health systems. Lessons drawn from the COVID-19 pandemic have led to the strengthening of international partnerships and the prioritization of rapid response mechanisms. Looking ahead, the path to improved global health will rely on collective action and innovation. The Sustainable Development Goals, with health at their core, remain a rallying point for nations, organizations, and individuals. Whether facing the lingering threat of emerging pathogens, confronting environmental calamities, or overcoming social and economic inequalities, no country can tackle health challenges in isolation. Hope resides in the spirit of collaboration crossing borders, disciplines, and sectors. Young leaders, community organizers, and health workers continue to drive change on the ground. Scientific discovery, policy innovation, and grassroots activism together forge pathways toward a healthier, more equitable world. In 2025, the story of global health is not one of unambiguous triumph or defeat, but rather of ongoing transformation. With each new challenge comes an opportunity to learn, to adapt, and to reaffirm the importance of health as a universal human right. The journey is far from over, but with resilience, empathy, and ingenuity, humanity continues to move forward, working toward a future where well-being and dignity are within reach for all. Reaching the milestone of 1.4 billion people living healthier lives stands as a testament to the impact of collaborative health initiatives and innovation. Improved access to essential care, nutrition, and education has empowered communities worldwide, leading to longer life expectancy and better quality of life. Preventive measures, chronic disease management, and expanded mental health support play crucial roles in this progress, exemplifying how coordinated global efforts transform aspirations for healthier populations into inspiring realities. As global health advances, major challenges continue to present formidable obstacles. Antimicrobial resistance threatens to render once manageable infections untreatable, raising concerns across healthcare systems. Climate change intensifies health risks, with extreme weather events and air pollution disproportionately affecting vulnerable populations. Rapid urbanization and population growth strain infrastructure and access to care. Inequities in healthcare delivery persist, often rooted in socio-economic disparities. Addressing these complex issues requires adaptive policies, robust investment, and unwavering international cooperation for a healthier future. Antibiotic resistance represents one of the most urgent threats to global health today. As bacteria evolve and develop the ability to withstand our most effective treatments, common infections and minor injuries risk becoming deadly once again. The misuse and overuse of antibiotics in both healthcare and agriculture accelerate this process, making it harder to control diseases. Combating antibiotic resistance demands coordinated efforts, improved stewardship, investment in new treatments, and global education to protect the effectiveness of these life-saving drugs for future generations. As climate change accelerates, its profound effects ripple through global health, amplifying the risk of disease outbreaks. Rising temperatures and shifting weather patterns expand the habitats of disease-carrying insects like mosquitoes, leading to increased transmission of malaria, dengue, and Zika virus in regions once considered safe. Floods, droughts, and extreme weather events further challenge water and sanitation infrastructure, heightening vulnerability to outbreaks of cholera and other waterborne diseases. Addressing these interconnected threats requires urgent, collaborative action across sectors. Wars and humanitarian crises continue to shape the global landscape, disrupting communities and placing immense pressure on health systems worldwide. Armed conflicts displace millions, leading to surges in refugee populations and acute shortages of food, clean water, and medical care. These emergencies heighten the risk of infectious disease outbreaks, exacerbate mental health struggles, and unravel years of development gains. Addressing these challenges demands coordinated international efforts, prioritizing protection, rapid response, and long-term support for affected populations. Healthcare inequality remains a critical issue, with vast differences in access, quality, and outcomes across regions and populations. Many communities, especially those in low-income or rural areas, face barriers such as limited healthcare facilities, shortages of trained professionals, and unaffordable costs. Social determinants like education, income, and housing further deepen these divides. Addressing healthcare inequality requires targeted investments, policy reforms, and partnerships that prioritize marginalized groups, ensuring everyone has the opportunity to achieve optimal health regardless of their circumstances. To address these complex challenges, the World Health Organization advocates for a multifaceted, collaborative approach. Strengthening universal health coverage remains a top priority, ensuring that everyone, everywhere, can access essential services without financial hardship. The WHO also calls for increased investment in disease surveillance, robust health information systems, and workforce development. By fostering partnerships across governments, academia, and local communities, the aim is to build resilient systems that can adapt to emerging threats while championing equity and global solidarity.